So today we're going to be performing a biomechanical lower extremity examination on our patient. So the first thing you want to do whenever you start off doing one of these is to assess the femur and the tibia length. So the first thing I have her do is can you bend your knees up for me? Put your feet equally apart. Okay. Measuring femur length. We'll look across the knees here, which the right femur appears to be slightly shorter than the left. And then assessing tibia length, looking at the top of the knees. And then from here, assessing the leg length. I'm going to have you, first thing to do is to reset the pelvis. So if you can bridge up, bring your butt up off the mat and back down. Okay. Pulling the legs out, making sure that the ankles are equal and straight, following underneath the hips. And then looking down, measuring at the malleolus. Each is the same. All right, now I'm going to have you sit up. Measuring the same. Both are equal. All right, and for the sake of this video, I'm going to be doing the right foot. So first thing you want to measure is malleolar torsion, which you just want to eyeball it off of the horizontal plane. Is normally 20 to 30 degrees, and that looks to be just about right. From malleolar torsion, you're going to go to checking out the forefoot plane. So forefoot plane, you're just measuring the calcaneus to the forefoot and where they meet, kind of right in the middle, which is normally 12 to 16 degrees. She looks to be normal on this side. From checking the forefoot position, I'm going to test the mid-tarsal mobility. So the mid-tarsal joint has two axes of motion, they're both oblique and longitudinal axis. And when measuring those two, it's important to know that you should test the foot in pronation and supination. When the foot is in pronation, you can expect there to be more motion, and when you're in supination, there'll be less motion. So first, testing the oblique axis in pronation. I'm going to test for plantar flexion and abduction, and dorsiflexion and adduction. So testing the same motions in supination. And testing the longitudinal axis, you're testing for inversion and eversion. And then in supination, the same. Okay. And from mid-tarsal mobility, going on to the first ray, you kind of want to assess to see if it's plantar flexion or dorsiflex when comparing it to the other metatarsal heads. Hers is normal and in line. Testing its mobility, I'm going to test going kind of like up and out, down and in. Just testing for overall motion. From the first ray, when going to the hallux, you can test both the motion with a goniometer and test to see if it's varus valgus or normal. Hers is in line. And then from the hallux, you go into the lesser digits, seeing if there's any hammer, claw, or mallet toe. Hers are all in line and good. Okay. And then the final thing to do while the patient's in supine is to just check the plantar surface of the foot, checking for any calluses, seeing if anyone spends more time on one part of their foot than the other. Okay, hers are good, so can you roll over on your stomach for me? When moving into prone, this is where you want to draw your lines, midsecting the calcaneus and midsecting the leg above. For the sake of this video, I'm not going to do that, but just know that everything's supposed to be in the midline. From there, assessing where the talus is, where the talar heads. Okay. When you feel both heads equally on both sides, you want to assess those lines you drew from the calcaneus up the leg to see if there's any varus or valgus. From there, you want to assess the rear foot to the forefoot to see if there's any varus or valgus there. Also, while in prone, you can test subtalar range of motion, whether that's inversion, which is about 20 degrees, or eversion, which is lesser in 10. So she's got good motion. And then finally, you can test ankle range of motion between dorsiflexion and plantar flexion. All of these motions are used or tested with a goniometer. So can you bring your toes up towards your knee for me? Okay. When testing dorsiflexion, it's important to remember to measure along the calcaneus and not to the fifth metatarsal, because that might add some extra motion that's not actually there. And then point your toes for me. Okay. And bend your knee up. And bring your toes back towards your knee. Okay. And all of these again measured with goniometer. Alright, you can stand up here for me. Face that way. So while standing here, you can assess and look for too many toes, which I do not see. You can also assess the patient's neutral and relaxed stance. So I'm going to have you roll your ankle all the way out to the right until you feel the talar head, and very slowly come back in towards the left, right there. From here, those same lines you drew on the back of the leg with an inclinometer, you're going to measure for neutral tibial stance and the neutral calcaneal stance. All right, and now you can relax. Again, with an inclinometer, measure the relaxed stance, and then you take the difference between neutral and relaxed to get the excursion rate. Excursion is normally 4 to 6 degrees. Okay. While you're here, you can also test for the weight-bearing hallux dorsiflexion. I'm just going to bend your toe up. Don't leave your other toes down. Only about 10 to 12. Testing windlass mechanism. And then I'll have you sit on the edge here. With your feet flat on the ground. For this one, you make a mark on the navicular. Get it lined up and make a mark where it is. Okay, for this one, whenever you stand, don't move your feet, just look straight ahead. Don't move around, okay? All right, you can go ahead and say it for me. And then you re-measure the navicular and take the difference, and that's your navicular drop. And finally, you can have the patient do a walk up and down the aisle to assess their gait. So you want to walk back and forth for me. And you're watching to see if you see anything noticeable. If you have the equipment, such as the apps to use for more appropriate gait analysis, you can do that. But if not, just a normal gait analysis within the clinic will do.